Hi, I'm Rosemary Clee, the Executive Director for the Bergen Newbridge Medical Center Foundation, New Jersey's largest not for profit hospital, and the sponsor of In the Know It Row, an informative conversation with leading clinicians on important health topics. Today I'm joined by Rick Moses. He's a licensed clinical social worker and a licensed clinical alcohol drug counselor at Bergen Newbridge Medical Center. He received his master's degree in social work from Rutgers University. Over the past 11 years, Rick has provided mental health and addiction services to clients at agencies like New Jersey Drug Court and NCADD New Jersey, as well as multiple substance abuse and dual diagnosis treatment centers. He has experience working in all levels of care, including detox, long-term, short-term residential, medication-assisted treatment, partial hospitalization, outpatient, and intensive outpatient. Rick has completed advanced training in REBT at Albert Ellis Institute in New York City, but he's also borrows from CBT, DBT, psychodynamic, and 12-step approaches. As Rick puts it, my goal is to tailor treatment to the individual. The best approach is the one that works. The coronavirus 2019 COVID-19 pandemic has been associated with mental health challenges related to morbidity, mortality, and caused by the disease and the mitigation activities, including the impact of physical distancing and stay-at-home orders. Now that the CDC has made some changes in the orders, Rick and I will take a look on the impact COVID-19 has left us with on mental health. Good morning, Rick. How are you?
I'm doing fine. Thank you.
So did COVID-19 pandemic cause mental illness or addictions?
Well, that's a great question. What we know is that it appears that what we've learned from other epidemics and disasters holds true for what we've seen in the COVID-19 pandemic. Several surveys conducted about that subject included substantial evidence that we did indeed see an uptick in mental illness. We CDC surveyed approximately, thousands of people in late June 2020, and 31% of those respondents reported symptoms of depression and anxiety. 13% reported starting or increasing substance use, and 26% reported stress-related symptoms. So the pandemic in itself, because it was so significant, did cause an increase in mental health symptomology. So it's fair to say that the pandemic had an incredible negative impact on people. And we know that some of these mental health symptoms will be persistent and long lasting. And after we've recovered and we're well on our way to recovery, some of those symptoms are going to be lingering on.
So now that we have a vaccine and restrictions are being removed, shouldn't mental illness and addiction services related to COVID-19 pandemic cease?
Well, not necessarily. I mean, it depends on each individual. Some people will show some improvement and may not need any type of intervention, but many people experience such traumatic loss, seeing a loved one pass away, disruptions in everyday functioning, incredible financial difficulties. So these things are going to have long-lasting effects, and some folks will need to seek some type of intervention even after the pandemic stabilizes and we see recovery like we are right now.
So should meetings and treatments options stay hybrid or virtual going forward? Do you feel like these are effective?
Well, right when the pandemic hit, a lot of things went offline and went all virtual. A lot of services ceased or at least were limited in terms of skeleton crews. So there were times that people could not have in-person services, but things like 12-step meetings that went all virtual can start to move back to in-person. Some are already back in person right now.
Right.
Some are virtual. But I think that as conditions improve and more people get vaccinated, it'll be, people will be able to start getting back together in smaller groups.
Do you feel like they're more effective being in person? I know that when you're going for counseling, it's a
Hmm.
little bit more convenient. And I found that especially if you have difficult, scheduling wise,
Hmm.
being virtual is more convenient. Do you
Yeah,
feel that is a significant difference?
I think virtual presents a viable option for people, but there's nothing like that person to person touch, that when you're with someone, you're able to connect more. Patients that we interviewed during the pandemic, as you know, we went to a hybrid option with behavioral health services, or some behavioral health services, I should say. And patients reported that they missed the connection of being in person and seeing each other and connecting with each other. You lose a little bit when you're only able to see someone on a screen. It's a little more difficult.
Are you finding that the COVID-19 induced mental illness addictions are less severe?
No, we're not seeing that, because addiction is addiction. Like I said before, the 13% of people reported that they either increased substance use or started substance use. So once you start something, it's really hard when it comes to a thing like addiction to be like, okay, now it's going away. We've seen that those things don't go away. So those people will, or I should say, may need help. And you shouldn't be ashamed to go looking for help if you know you're in trouble.
So is there a way to provide treatment to the opioid user that can't come to a daily treatment due to the fear of catching COVID-19?
Well, there are some virtual options for people that are still really hesitant to go in person. Like if for opiate users, one thing that's been really effective here at the hospital is our Suboxone program. Because with the Suboxone program, you're coming for your Suboxone monthly. Initially, when you start, you come weekly for a group session and meeting with your doctor and getting your medication. But then after about a month, you move to coming to treatment once a month. See your doctor, come to a group, connect with others, work on relapse prevention or things like that. And then, you're able to continue to go about your life. And if COVID fear is still something that's in the forefront of your mind, you can seek treatment that way. You can do outpatient therapy. In our outpatient program, we provide services via Doxy. So the person has individual therapy via Doxy, which is very much like Zoom. And they can, see their therapist twice monthly, receive treatment that way, and see their doctor virtually, once a month. So there are options for you.
So do patients prefer hybrid or in-person programming? Have you seen a preference
I think
feedback-wise?
most patients prefer to be in person. We talk to our clients all through the pandemic. We talked to them when we were all virtual, because in the beginning, when everybody went home, we were all virtual. We didn't bring anybody in at all, and patients were clamoring to get in. So now that we're back in, we're not 100% back in the APH program. For the dual diagnosis side, for the APH, we are. It's coming in every day, but for dual diagnosis, they're coming in 3 days a week. They want to come in full time. They're asking to come in full time. There are only a few patients that say, "Hey, you know what? I'm still a little uneasy. I want to, stay virtual for a while."
And so how do you handle that? The now that we're starting to open up more, the CDC just talked about, people that are vaccinated, that they have this amazing opportunity to take their masks off.
Hmm.
If there is a patient that is still going through the hybrid model, how do you transition them to start coming in person?
Slowly, we like to work with everyone individually and let them know that this is available to you. I could tell you a lot of patients are eager to do that. Some who are not will work with that individual. If they're not able to come every day, we'll try to work around a situation where they can do hybrid and be in person sometime and over the phone or through doxy the other times. So each case is different, and people respond to the pandemic differently. There are people who are still very concerned about getting COVID. And there are others who are feeling like I'm okay. I can't wait to get back into doing what I have to do.
So with the new CDC rollout, they're saying masks off,
Yeah.
with your professional opinion. Again, this is your opinion. Do you feel that there's going to be an uptick with people feeling uncomfortable with, being out there with no masks? I mean, this is like, we went from mask mandate, social distancing, stay-at-home orders to now you can take your mask off if you're vaccinated.
Yeah.
How can we assure that somebody that has these questions on if this is okay, that they won't turn to their addiction or other coping mechanisms to handle this?
Well, I think, again, you have to treat each person individually. Some people can't wait to get out of the mask. The mask has been something that they've been uncomfortable with. This new order has given some people some hope and some freedom. It shows that we're making strides. I think we're somewhere around 115 people in the 115 million vaccinated folks already, and we're working to continue with that number and vaccinate more people every day. But there are going to be some people that are going to feel really great about it, and some people are going to be a little concerned that, hey, how do I know you're really vaccinated? You're taking off your mask. So I think it's hopeful, and what I would tell people is look at the positives. That we are making strides at breaking the back of COVID. We've gotten people vaccinated, and the vaccines are providing some security for some. But if you're feeling some hesitation and you want to keep your mask on, well, then, hey, you keep your mask on. If you feel like that's going to help you to feel okay, you really need to go by your own heart and decide what makes you feel okay.
So when do you foresee going back to all-person programming?
That's hard to tell. I know that that's being looked at right now. When it's safe, we'll go back to in person whenever that time is. But it's hard to really say exactly when that's happening. But we're actively looking at that now at the hospital. I'm sure of it.
So can you tell us a little bit about your programming with the dual diagnosis piece, how that works? They would call the Access Center, is that correct?
Sure. It all starts with the Access Center. And like I said, a lot of people are experiencing, symptoms of mental health, mental illness, just with the pandemic. Just going through a pandemic can increase the amount of anxiety that one feels. So if you are experiencing symptoms and you're feeling uncomfortable and you see it's interrupting your functioning, you're not able to go out as easily as you were before, or if you have feelings of sadness or despair, don't hesitate. Call our Access Center. It's 1-800-730-2762. Call the Access Center and they'll get you connected. So let's talk a little bit about the APH program. APH stands for Acute Partial Hospitalization. It's an intense program for people whose symptoms are severe enough where you would benefit from a program that's 9:30 in the morning till 3:30 in the afternoon. It's a 5-hour program. It meets 5 days a week. And it's a specialized program. We have specialized programming for people that are coming in that are mental health only. We have specialized programming for people who have dual diagnosis, meaning a co-occurring addiction problem along with a mental health problem. And it has specialized groups to provide the support that you need. So we do things like distress tolerance, relapse prevention, thinking change. We have groups specialized for people who have trauma. We have the Hope Over Harm group for people who have had suicidal ideation or self-harm. We have anger management, We have spirituality. We believe in treating body, mind, and spirit. So it's not just about providing medication. We're going to provide you therapy that's going to hit all those areas. Everybody that comes in is assessed, and if you have a medical issue, and make a referral for your medical issue so you could feel better for any medical things that are going on. We talk about spirituality in terms of finding something outside of yourself that you can pull from. And you know, of course, we use evidence-based practices, whether it's RBT, CBT, DBT. We use the best evidence-based approaches to addiction and mental health. And then there's the outpatient program as well, so as a step down. So after you do APH, you can step down to the outpatient program and continue with individual therapy, you know, twice a month to make sure you're continuing your program and getting the help that you need.
Do you have to start as an inpatient person to start the
No,
APH?
you don't have to
Okay.
start inpatient. What happens when you call the access center is they're going to get you connected, and then there's an assessment is going to be made to find out what's the best level of care for you to treat those symptoms. So for some people, they may not need inpatient at all. They may be able to come in and go into an outpatient program where they seek medication and seek therapy. And then some people may have conditions, the severity of which may require you to come in, or it may be more beneficial for you to come in for a program where you're here all day from 9:30 in the morning until 3:30. Or maybe there's an addiction issue and that's primary. And then you can go into our Evergreen program and you seek just IOP, you know, 3 times a week. 3 hours each time to treat an addiction problem that's really primary at this time. So there's a lot of options. We believe in connecting you with the right treatment and the right level of care to provide the healing that you need. You know, so it's really specialized and it's based on each individual.
So does the Access Center make that determination which one is primary? Or is there an evaluation that happens when they arrive here at Bergen Newbridge Medical Center?
Exactly. There's an evaluation that happens, and you're going to meet with a psychiatrist, and they'll do an examination. They'll figure out what's the issue and what really would make the most sense for you to get the care that you need. Because people may not know. They may think that your issue is more a mental health issue, and you may be neglecting the fact that there's a substance issue that's really driving some of this behavior.
Right, exactly. So this was really informative, Rick. You know, thank you so much for joining me today.
Mm-hmm.
And I thank everyone that tuned in. For more information about services here at the Medical Center and to learn more about the foundation, please visit us at newbridgehealth.org. And we did place the Access Center phone number on our screen if you'd like to call the Access Center. If you're thinking of, you can use a little bit more support, please reach out to us. It would be appreciated. And thanks again, Rick, for joining me.
Thanks for having me.
Thank you. Take care.
All right.